Corns are a type of callus that forms on the top of the toes, usually at that PIP or DIP joint. That would be the close PIP joint here, or the DIP joint just behind the toenail. They're easily trimmed or sanded down, but the most common question I get is, how do I get rid of corns permanently? The answer is a procedure, and it's performed on an outpatient basis under general anesthesia with some local anesthesia. Allow me to illustrate. Now, as you can see, the bones in the feet have kind of a skinny diaphysis or shaft in the middle, and then right where the knuckles are, this was that PIP and DIP I told you about joints, it's quite wide, and it forms a sharp point here and here, especially on the outside of the fifth toe where you see the corns in this area. The procedure basically takes a small little area of bone here right at the neck, so it essentially makes a smaller head. This is the head of the proximal phalanx. Smaller head, this bone is removed, and then of course we put some sort of stabilization. I use absorbable pins that go inside the bone that don't exit the tip, and without the metal, of course, you have to worry about removing it. On the skin, what we'll do, this representing the corn, we'll make a elliptical incision, so from side to side we'll go around here and around here, and then you can lift the whole center out and these two edges close with a straight line with absorbable suture. Postoperative care, extremely simple. It's not like a fracture where you have to stay off your feet for 4 weeks and use crutches. You can partially weight bear. We do ask that our patients keep them dry to prevent infection. After 2 weeks, since we use stitching under the skin and some steri strips, we just take the tape off, test the edges, and if they're well sealed, you can get them wet, go back into a shoe. At around 3-4 weeks, you can start to exercise more vigorously. Depends on the swelling and discomfort. 3 to 6 months, the scar tissue is faded, and you can do anything you want. About a year until the scar tissue flattens and disappears completely. If you're interested, you can watch the surgery video performed in the operating room. At the end of this video, you can click on the link. Thanks again for watching. Stay healthy and one step ahead.